warm-up is one of the most vital components in any exercise program. It ensures blood flow, mental and physical readiness for your workout ahead, and minimizes risk of injury. For our first exercise, we'll be doing the push-up. The push-up works out your pectoral muscles, deltoid muscles, and triceps. The muscles involved are your pectoralis major and minor, your deltoids, which are in use in your upper supinatus, your infrasupinatus, subscapularis minor, and your upper arms that you use, which is your biceps and triceps. Your back muscles that are in use is your latissimus dorsi, rhomboids, and trapezius. The antagonist muscles are your back muscles, biceps, and rear deltoids. The agonist muscle are pectoralis major and biceps. The three main joints involved are the hinge joint in your elbow or socket joint in your shoulder, and your condyloid joint in your wrist. The action at the elbow is flexion during the downward movement and extension during the upward movement. The action at the shoulder, flexion and horizontal reduction. I will now be demonstrating how the push-up is done. Place your hands shoulder width apart with your feet straight back, your back in a straight angle, and push up. My client will now perform the push-up exercise. Keep your back straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. For our next exercise, we'll be doing the squats. The squat movement strengthens and tones the lower body. The muscles in use are your gluteus maximus, your quadriceps, which are your rectus femoris, vastus lateralis, vastus medialis, and your vastus intermedius. Your hamstrings, which are your biceps femoris, semidenosus, semibrenosus. The back muscles in use are your rectus spinae, thyroid muscles, and your adductor muscle, magnus. Calved muscles would be the soleus and gastrocnemius, abdominal muscles, rectus abdominis, and obliques. The antagonist muscles are your quadriceps and your agonist muscles are your hamstrings. The joints involved in the squat are the ball and socket joints in your hip and the hinge joints in your knee and ankle. The action at the hip and the knee during the downward movement causes flexion, and at the ankle it causes dorsiflexion. The downward movement is an eccentric muscle contraction. The action at the hip and knee joints during the upward movement causes an extension, and at the ankle it causes plantar flexion. The upward movement is a concentric muscle contraction. For our next exercise, we will be performing the squat. With the squat, keep your feet shoulder width apart, squat down until your legs create a 90-degree angle and go up. Keep your head straight and your back straight. Okay, my client will now be performing the squat. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For our next exercise, we'll be doing the single leg Romanian deadlift. This exercise helps improve stability as well as overall body control. It is a hip dominant exercise that strengthens your glutes and hamstrings. The target muscles worked are your glutes, gluteus maximus, your adductor magnus, your semibrenosus, biceps femoris, gracialis, and semitendinosus. The other muscles activated included are the latissimus dorsi, obliques, spinal erectors, traps, and quads. Your glutes, quadriceps, and hamstrings act as a movement and agonists, while these are also antagonists in this exercise. The upward movement at the hip and knee joint is extension, while the ankle synovial joint hinge is plantar flexion. In the downward movement, the hip and knee joint is flexion, while at the ankle it is dorsiflexion. The upward movements are concentric, while the downward movements are eccentric. For our next exercise, we will be performing the single leg Romanian deadlift. For this exercise, again, keep your legs shoulder width apart, keep your arms straight and go down with your back being straight. My client will be holding onto the bench for added support and safety. Remember to keep the legs bent slightly and your back straight. For our next exercise, we'll be doing bent over row. A bent over row is a weight training exercise that targets a variety of back muscles. Muscles included are the latissimus dorsi, middle trapezius, major and minor rhomboids, biceps brachii, and erectus spinae. The agonist muscles are the infraspinatus, latissimus dorsi, rear deltoids, rhomboids, major and minor, middle and lower trapezius. The antagonist muscles include the erectus spinae, hamstrings, glutes, and adductor magnus. The abdominal muscles and the obliques in your core serve as antagonist stabilizers. In the bent over row, the major action is the shoulder joint extension. In this movement, the arms remain in a vertical plane and move from a position from in front of the body to a position alongside and behind the body. To allow the arm to rise above the level of the back scapulars, slide in towards the spine via contraction of the rhomboids and middle trapezius. There is also a downward rotation of the scapula via contraction of the rhomboids and pectoris minor. The lower portion of the pectoris major is involved at the beginning of the movement, but not as the elbows approach the sides of the body and respire above. For our next exercise, we will be performing the bent over barbell row. With this exercise, keep your feet shoulder width apart, your hands shoulder width apart, bent over, straight back, and pull to your sides. Keep your back straight. For our next exercise, we'll be doing the plank. The plank exercise is an isometric core contraction exercise that involves maintaining a position similar to a push-up for a maximum possible time. The target muscles are your rectus abdominis. The stabilizing muscles include obliques, iliopsoas, tenoid fossa, quadriceps, sartorius, pectoralis major, and serratus inferior. The antagonist stabilizers are the erectus spinae, middle and lower trapezius, and rhomboids. Your joints that are in the action are your shoulders and your hip girdle, which are ball and socket joints and are used to bear the weight. The other joints that are used is your ankle synovial joint and elbow hinge joint. For our next exercise, we will be performing the plank. With the plank, keep your arms shoulder width and your back straight with your legs together. Keep like this for at least 30 seconds. With the plank, there's another adaptation. You can use side planks and also lift your legs up for core stability. My client will be performing the plank for 30 seconds. Remember to keep the back straight. feet together. This concludes the ending of our full body workout. I hope you enjoyed the video and thank you so much for your time.
Oeh, wacht.